Today in our Eye on Health, we are talking about something that may not affect your body's physical health.
But it is talking about patients and how they may become victims of healthcare fraud. That's something our guest today is trying to fight against. Kurt Spear is the Vice President of Financial Investigations at Highmark Blue Cross Blue Shield. Kurt, thank you for being here with us today.
Thank you.
We want to start just first by asking you, when we say healthcare fraud, what is that? What does that look like?
So healthcare fraud takes a lot of different forms and shapes. Typically, it's unnecessary services that are being provided to individuals or medical claims that are being submitted to an insurer that are fictitious or otherwise egregious. It should not be paid. So in some way, it's trying to fleece the system of money, whether it's an insurer, the individual, or potentially the government.
And I would assume the more this goes on, it raises rates for all of us, right?
Exactly. So, there's multiple issues with healthcare fraud. It could be safety and wellness issues for the patient, excessive cost for all of us as taxpayers, as well as you mentioned the premiums going up for all of our healthcare.
So these could be individuals who are submitting false claims, but also it could be facilities that are also asking for too many tests or unnecessary testing.
Correct. What we're really seeing across the country is a trend is in the past you had individual providers who potentially committed fraud, and we still see that today. But really on the rise over the past 3 to 5 years, we've seen an increase in more organized schemes, which are broader, more nationwide, very well funded, very well organized, and happening across the country.
So if you get a bill for something and you think, hey, I didn't have this test, you should be contacting your healthcare provider and not just saying, well, whatever.
Exactly. A great way to identify suspicious activity is to look on your explanation of benefits that members receive as part of their claims activity. We have a number for our fraud hotline that individuals can call in. I have individuals on my team that answer that hotline, can help answer any questions a member might have. There's also phone numbers on the back of your membership card. So if you have concerns about a bill that you get or activity that you've seen, best thing to do is to reach out to us.
And so what happens if it's a doctor or a provider issuing a test that you don't know if it's necessary or unnecessary at that point? You're just trying to get the best care possible.
Yeah, the best thing to do is always ask. If you have a question, ask your provider. Even in the dental space as well, we see this with the opioid epidemic happening. If you have questions about how much medication you're getting for tooth extractions, for example, ask your provider, do I need this much medication? Is this something that's really necessary for this procedure? Could I take something at a lower dose? And the same is true with procedures. If you have questions, ask your provider. Feel free to ask your health insurer as well if you have any concerns.
And really, we should think of our insurance card more like a credit card as far as protecting the numbers on there, right?
Absolutely. And it's not just your membership card either, it's all of your data. So some of the large fraud schemes we've seen over the past couple of years that really target seniors are individuals that go out on social media. It could be Facebook, Instagram, etc. But there's organized individuals across the country that target seniors specifically and ask them if they're having pain, if they want free healthcare services, medical devices like back braces, orthotics, and they try to induce the individual to provide their health insurance information. Once they get that data, then they can start billing fictitious claims back to the health insurer. Ultimately, that hurts the individual for unnecessary services and potentially devices, but also raises the cost for all of us.
It's interesting and something that I haven't really given much thought to, but you really have to be aware and cautious and looking at everything.
Yeah. Thank you so much for stopping in and educating us today.
Absolutely. Thank you.
Appreciate it. We appreciate it. Well, keep watching our Eye on Health series here on PTL. Happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health. And when it comes to your health, so many people now have questions about the coronavirus. How is it spread? What should we really be doing to protect ourselves and our families? So we're going to do something pretty special tomorrow.
We are bringing in a doctor with Allegheny Health Network to answer your questions about the coronavirus. So here's what we want you to do. Head to our Pittsburgh Today Live Facebook page right now and leave your questions for the doctor. We're going to post a little video there explaining about the segment, and you can just submit your comments and your questions underneath. We will speak with the doctor tomorrow about the coronavirus, why it's different than the flu, and why it poses such a threat to places around the world. So stay tuned for that segment tomorrow.
Yeah, I think a lot of people have questions, and this is the opportunity to get some answers.